The number of positive COVID-19 cases in Ontario may be trending upward, but London ICU doctors say that's not the only measure we should be looking at. CTV's Bryan Bicknell had a rare opportunity to gain some insight from some of the city's top ICU physicians. He joins us now with more. Bryan.
Well, one of the main messages here is, yes, the numbers are going up right now. That is true, but it's not a time to panic because we're in a much better position to manage the second wave. It's another day of positive case counts not seen since spring in Ontario, and the rolling one-day average over 400. But it's only one indicator of COVID-19 severity, says this intensive care physician.
We increase our engagement with one another. We put people back in schools. The cases going up is not a mystery or a surprise, and in many respects it's not even news, in my opinion. It's expected.
Dr. Robert Arntfield is the medical director of the ICU at Victoria Hospital. He says rather than just case counts, a more complete measure of the pandemic is hospitalizations and deaths.
Other countries that have seen really big second wave numbers, a lot of them in Europe, have seen a different response in terms of hospitalizations and deaths. There certainly is a magnitude and there is an importance to that, but it is not anywhere near the same level that we saw back in the early waves.
As of this day, there are fewer than 100 COVID hospitalizations in all of Ontario. In London, there have been none in the last week, according to the chair of critical care at LHSC. Dr. Haddara says if that changes, ICUs are better prepared than in spring.
In terms of ICU beds, creating capacity to accommodate patients if we need to. So we're hoping for the best, but preparing for the worst.
Now, it's a message we've heard before, but the doctors also stressed that how well we manage to get through this second wave depends a lot on all of us and how well we can follow rules around social distancing. Roughly two-thirds of recent cases are people under 40. The younger demographic less likely to be hospitalized, says Dr. Haddara.
The challenge is that younger people don't and should not exist in a bubble from the rest of society. And so as younger people encounter, older people, the rates of hospitalizations will be very similar to what we saw in the spring.
Now, another interesting point that Dr. Arntfield makes is that the numbers may go up or down, but we are in this for the long haul, at least until there's a vaccine and we develop some level of herd immunity. Back to you.
Okay, Bryan Bicknell with some insight into the COVID situation here. Thank you.